Now, let's welcome Dr. Kaylan Edwards of Novant Health Pediatrics, Brunswick. Dr. Edwards, it is so good to see you again.
Thank you.
I know that you told us about your education and where you went to school and everything last time, but maybe somebody missed that show. So let's refresh our viewers' memories.
So I grew up in Wake Forest outside of Raleigh, and my family is from Whiteville. So we grew up a lot of our... Yes, you have to say it correctly, Whiteville. So we spent a lot of our time growing up in this part of the state. I went to my undergrad in Raleigh at Meredith College, and then I went to East Carolina for both medical school and for my residency training.
Yeah. And how did you get here?
So Novant was interested in bringing pediatrics to the area, and they called, and it felt like moving home.
And of course you knew this area and everything, so you were coming back home.
Yes.
And your grandparents still live in Whiteville,
Yes.
Isn't that right?
Yes, they do.
Yeah. Well, let's talk a little bit about your office. I assume it's very kid-friendly.
Oh, of course. Bright colors, underwater creatures.
Underwater creatures?
Yes, all over the wall.
I've seen that office and I didn't see those. How come I missed that?
All over the walls.
All over the walls. I must not be looking around. So, well, I know with what's going on with the pandemic, it's been a real interesting time in your office as well as at the hospital. So how has your office adjusted during this pandemic?
Yes, so it's been a big adjustment really for everyone. Specific to pediatrics, it's very interesting because, you know, we see adults and children in the office because parents are bringing their kids in. So the biggest change probably that we've made is we only have one parent and one child in the office at a given time, and we screen every patient and their parent before they come into the office. We also have parents call before they ever walk in the front door.
Oh, nice.
So that we can make sure one family is not in the hallway or in the lobby at the same time as another family, just to increase some distancing.
That's some serious
Yes.
scheduling there.
Yes.
I don't know how you do that.
Yes.
Well, what about if a child is sick?
So one of the wonderful things to come out of this has been video visits.
Yeah.
And we've had quite a few of our patients take advantage of that, and it's been really neat to do them. So for sick patients right now, we see a lot of them on video visits. We also ask them all the screening questions as well. If we have any concern that they possibly could have the coronavirus, then we're sending them to be tested. Just precautionary for everyone. Thankfully, we haven't seen this huge in children in our area, but we still are very cautious about it.
Well, I was going to talk about all the measures that you're taking to keep parents calm and keep them bringing their children in when necessary, but you've kind of told me all that. So it sounds like a pretty safe office to visit.
One other thing we're doing is we're trying to keep our sick patients being seen separately.
Oh, sure.
A complete separate time of the day than our
But they are separate anyway. You have a separate waiting area for your sick patients during normal times.
Yes.
Yeah, so that's always nice. Yeah. Video visits, does the patient or does the parent act like the practitioner what do they do?
Yes.
How do you do a video visit with a child?
So video visits have really come about during all of this for us, and we've just been figuring out as we go. So we do them for sick visits, and if the child is sick, one big thing in pediatrics is you can look at a child and really rate how sick they are. And you can typically look at a child and say, well, they need to be seen by someone hands-on, or let's see what we can do by video to try to keep them home. A lot of parents really are skeptical about coming into the office.
Yeah, I'm sure.
But a lot of times our parents are practitioners. Some of our families have the Tido home care, which has been really fun.
Yeah, that's a pretty neat tool.
Yes. And we're also using video visits for some well care and just health maintenance, so that's been good as well.
Yeah. Well, let's switch topics a little bit. During this time of the year, there's always these huge fireworks displays, and I want to talk a little bit about safety in terms of fireworks and water and what have you. So if we're having fireworks at home, since the displays are all canceled, what advice do you have for parents?
So this year,
Just don't do it,
right?
right?
Well, and this year I'm planning for there to be more home fireworks because of all of our displays being canceled. The biggest thing is children should really never be around fireworks.
Of course.
Our teenagers are the ones I worry about most because sometimes they're just around them and our parents don't know. One big thing I tell families is always keep a bucket of water near fireworks. It sounds common sense, but there should be there. The other big thing is to never relight a firework that kind of was a dud and somebody wants to try because it was expensive. So never relight fireworks. Yes.
Yeah, well, going to water, we live around so much water here. And I don't know, when do you teach children to learn to swim? How early should you do that? And what other precautions do we need to take in terms of water safety?
So one big thing is we do know that children who are over the age of 1 who have had some sort of training around water do have a decreased risk of drowning. Unfortunately, all children less than 1, we don't really know if it helps or not. And even a bigger problem right now is there's not a lot of swim lessons being offered because of our pandemic. So the biggest thing is I say any child less than 5 years old should always have a parent within arm's reach. And it sounds crazy at times because, you know, we have some 5-year-olds who are pretty independent, even 3-year-olds. Yeah. But a parent should always be within arm's reach, or an adult. Another big thing is children watch our parents and they watch adults and they mimic everyone. And so every person should always have a life vest on, and every person should always make sure their life vest fits. My husband gives us a hard time because even our dogs wear a life vest when we're on the water, but we have to set an example, and it's the role of us as parents and adults in our community to set that example for our children.
And this isn't related to water, but sort of. Sunscreen. Now, I hate sunscreen. I just don't like the way it feels. But I looked at my grandchildren the other day. They had so much sunscreen on, I'm afraid they're going to get a vitamin D deficiency. So what's the rule of thumb with sunscreens?
So really we can get all the vitamin D we need in about 15 minutes in a day.
Oh, really?
We can even...
Oh, I should be real.
Yeah, it should be good.
I should be full.
Really, any child less than 6 months old should not be in the sun at all. If they have to be in the sun, you know, light layers. I even encourage our parents to have light layers on their kids. They make so much apparel now that's waterproof. I mean, or waterproof and sunproof.
Yeah, I know. Even dresses for grown-up women.
Right. So it really has made that much easier because a lot of people don't like sunscreen. The other big thing is sunscreen should be worn. The big things are your face, your ears, the tops of our feet because it hurts to walk if they're burned. And especially on our little ones, the tops of the feet get burned and we don't realize it. Yes.
And then reapply?
You should reapply sunscreen every 2 hours. Parents often ask what SPF, and the Academy of Pediatrics says anything over 15. Which seems low.
I see these 75 and 100, and it seems like you're paying for nothing because who's going to stay out in the sun 100 times longer than...
Yes.
You know.
So the big thing with those sunscreens is they offer us to feel better, like we can go longer.
Yeah.
So it's safer to use SPF just over 15 and apply it every 2 hours. Reapplication is most important.
And especially after you've been in the water.
Of course, yes. I tell families to avoid the most harmful rays from 10 a.m. to 4 p.m. if possible.
10 to 4.
Yes.
Yeah. It's funny, being at the beach and around water, I see so many babies at the beach.
Yes.
And I always worry about their skin is so thin.
It is.
And that's really scary. But.
Yes. And we recommend for them to just be in a covered environment. So over their crib cover, over a tent, underneath an umbrella.
Right. So.
Yes.
You're taking new patients, correct?
Yes, we are.
Good.
Yes.
And you have a partner?
Yes. Dr. Lori Tackman is our other pediatrician in the office, and we're both accepting new patients.
Awesome.
Yes.
So tell our viewers how they can make those appointments.
So we encourage all of our parents to call the office. Our phone number is 721-4400, and we can get them scheduled. often we can get them in the same day.
That would be great.
Yeah.
Yeah. And it's located?
We are right off of Highway 17, off of Medical Campus Drive in Supply. So we're about a mile from the hospital.
Right, yeah. Okay, well, it was great to have you on the show today, and I look
Thank you.
forward to having you back soon, and
Yes.
hopefully the pandemic will be over.
We hope
and
so.
we won't be still wearing masks.
Yes, and staying 6 feet apart from each
Right.
other.
So we're
Yes.
okay now because we don't have masks on, but we're
Right.
6 feet apart.
That's right.
And we work together in the same office, so we're
Yes.
kind of like family.
Yes.
So we're together all the time.
Yes.
And there's no one else in this room but us.
That's right.
So,
That's one
but
thing I tell families.
Wear
is-
your masks,
Yes.
correct?
All children should be wearing their mask anytime they're in public, whether it's just around a few people or a lot of people, and trying to keep them away from big crowds as much as possible.
Right, so
Yes.
wear your masks.
That's right.
All right, thanks again, Kaylan.
Thank you.